Hello everyone, welcome back to my YouTube channel and I am Smriti Bhatia, and in today's video we are going to study about the posterior compartment of the forearm. And in the posterior compartment of the forearm we have the extensors and the supinators. So in the anterior compartment that we have studied in the last video, we studied the flexors and the pronators of the forearm, and in this video we are going to study about the extensors and the supinators. So starting up with the deep layer, we are going to see the first muscle, that is the supinator. So supinator muscle starts from the posterior side of the ulna and it attaches and inserts over the lateral side of the radius like this. So it helps in supination of them, that is this movement when the finger faces towards the roof, that is supination. Next up we have is abductor pollicis longus. Abductor pollicis longus, as the name suggests, it helps in abduction of the thumb and it is a long muscle. So it helps in the abduction. Abduction means this movement, and this movement comes from this muscle. This muscle, and it originates from both radius and the ulna, and it goes like this. This is abductor pollicis longus. Next up we have is the extensor pollicis brevis and the extensor pollicis longus. Now a depression that we can see over here, this is known as the anatomical snuff box, and it is made in between the extensor pollicis brevis and extensor pollicis longus muscle. So extensor pollicis brevis is a shorter muscle and it comes from the radius, goes and attaches to the thumb like this. Extensor pollicis longus is a larger muscle and it originates from both the radius and the ulna. From the ulna, this is the radius, and it comes like this and it attaches to the distal phalanx, and it makes a anatomical snuff box over here. Okay, so the anatomical snuff box is made in between the extensor pollicis brevis and extensor pollicis longus muscle. Next up we have is the extensor indicis, that helps in the extension of the index finger. We are going to draw it with the blue. So it originates from the ulna and goes and attaches, this muscle that we can see over here attaches to the distal phalanx of the index fingers, and it helps in the extension of the index finger. Next we are going to study the superficial layers. So while studying the superficial layers, we have to keep this in mind that all the extensors of the wrist originates from the lateral epicondyle, from this portion, that is the lateral epicondyle of humerus, this portion. So first of all we have the brachioradialis. Brachioradialis is not the extensor of the wrist, but it is the muscle of the forearm and it originates from the humerus, and this bulk that you can see over here is the brachioradialis and it inserts over to the radius. So this is brachioradialis. Next we have extensor carpi radialis longus. It originates from the lateral epicondyle, goes through the radius and inserts over to the second metacarpal. Next we have extensor carpi radialis brevis. Again it goes from the lateral epicondyle like this and inserts to the third metacarpal. Next we have extensor digitorum. So extensor digitorum goes from here to here, from here to here, and helps in the extension of the digits. Next we have the extensor digiti minimi. It again originates from the lateral epicondyle and travels like this and helps in the extension of the little finger. That is why it is digiti minimi. Next we have extensor carpi ulnaris. So extensor carpi ulnaris originates from the ulna and inserts over to the metacarpal. And these are all the muscles of the posterior compartment of the forearm. Over here we have a extensor retinaculum. Over here we have the extensor retinaculum that helps to keep the tendon all together, all the tendons of the forearm. Okay, so that's it for today's video. In the next video we will be covering the hand anatomy. Till then, keep studying, keep learning. See you next time.